Well, good afternoon, everyone. We are sorry to interrupt this beautiful midwinter day, but as we have done throughout this long and arduous COVID-19 journey together, we want to be open in our communication with Islanders, and that needs to always take precedence over weekends or holidays. We've been successful as a province in the fight against COVID-19 because we have been consistent in our commitment to arm Islanders with the most up-to-date public health information. By providing Islanders with that information, it has helped to make all of us make better and more informed decisions. It has reaffirmed our commitment to adhere to public health protocols, and it has helped us be successful to date with regards to this pandemic. Along this journey, there has been worry and concern. There was our first COVID case in March 14th. There was our first case connected to a hospital or emergency room in early July. There was the first case connected to a long-term care facility this past summer. And there was a case connected to one of our high schools in November. And of course, most recently, the outbreak in Charlottetown, which led to our circuit breaker event heading into the Christmas season. Each time we hear of one of these COVID firsts, it's difficult news to digest. It does make your heart skip a beat. But also, each time, we have met the moments with courage, with determination, and we have worked with a tremendous group of professionals and experts to lead this province through. We are joining you today on this unscheduled briefing today to announce another difficult COVID first, and that is we've received confirmation that one of our existing and previously announced COVID-19 positive cases is of the UK variant. This isn't a new case, and our active case total remains at 2. As Dr. Morrison will outline here in a moment, we've been bracing for this reality. This news is not unexpected, and in fact, we're the last province to confirm a case connected to the UK variant. Dr. Morrison will walk us through the process and where we're at to date and provide more detailed information, but I just wanted to provide 2 important reminders to Islanders that number one, the UK variant is COVID-19. While it's a more contagious variant, it is a variation of the virus that we have been fighting since day one. The best and only way to contain the spread is to continue to do what Islanders have been doing so well for so long, and that is to follow public health measures, things like masking, to wash your hands, to maintain physical distancing, to get tested if you have symptoms, to stay home if you're sick, and of course, self-isolation for those coming into our province. And secondly, this is a great reminder for us not to take our fortunate and unique P.E.I. situation for granted. As we have seen in other provinces, things can change quickly. To keep doing the things that we need to be doing is of utmost importance, and Dr. Morrison will outline that in a second. This case is also an example of the importance of why we need to follow protocols properly, and by doing so, we're not only protecting ourselves, we're protecting those closest to us and the entire island public as well. Since March 2020, we have lived in a heightened sense of awareness and concern. We have faced this reality with a confident determination by doing what is necessary to do, and that is day after day, find a way to beat this virus back. As we make our way to what we can only hope will be the end of this nightmare soon, we need to now more than ever keep digging in, keep following the health protocols, and for all Islanders to remain hyper-vigilant. And with that, I will now ask Dr. Morrison to provide more information before we address some questions from our friends in the media. So.
Thank you, Premier. Good afternoon, and thank you for attending this unscheduled briefing on a Saturday afternoon of a long weekend. Late yesterday, we were notified by our provincial lab and the National Microbiology Lab that a positive COVID-19 sample from P.E.I. had been identified as a variant of concern, specifically the B.117 variant that has been associated with the United Kingdom. This case, a male in his 20s who has a recent history of travel internationally, was announced on February 4th. He remains in self-isolation and has been followed daily by public health. This individual did exactly what was required, and following arrival in P.E.I, immediately went into self-isolation at a location separate and apart from others. He has no close contacts while in self-isolation. Out of an abundance of caution, last night and today, we are following up with everyone on the February 1st evening flight from Montreal to Charlottetown. As part of our standard testing and isolation protocols, many of these individuals have been tested this week. They are all following an isolation or modified isolation protocol. Several passengers are being tested by the mobile unit this afternoon, and other passengers that were tested this morning have negative results. Paramedics involved in testing of the positive case have been tested and are negative. The screeners at the airport have tested negative. There are 4 passengers who have since left the province and are being contacted and advised to be tested. We are still arranging testing for 3 additional individuals. At this point, there is no indication the variant strain of COVID-19 has spread within our province. This variant strain was identified on routine testing. All of our positive COVID-19 samples are sent to the National Microbiology Lab in Winnipeg for sequencing. The identification of a variant strain is not unexpected, given that it has been previously identified in all other provinces. Although we were anticipating the arrival of a variant of concern, it is not the news we want to hear. Variants of concern are especially worrisome because we know they are more infectious than the original strain of COVID-19. It has been estimated that the variants are between 30 and 80% more contagious, meaning that if it is not contained, they will result in exponential spread. The arrival of a variant in P.E.I confirms how important it is that we remain vigilant and that we not become complacent with COVID-19. If we let our guard down, we are inviting COVID-19 to gain the upper hand and further disrupt our families, our communities, and our province. We know that COVID-19 moves with people and that we are at great risk of importation. Since the beginning of the pandemic, our strategy has been to try to keep the virus out of the province. And if we do get cases, we have detected them early through testing to limit transmission. With the arrival of the variant, we will be more resolute in our efforts to protect Islanders from these highly contagious strains of COVID-19. The detection of the variant confirms that our surveillance and public health measures are working. The border measures allow us to identify individuals coming to P.E.I and their travel history, as well as ensure they have appropriate plans to self-isolate for 14 days. The requirement to self-isolate for 14 days, supported by daily check-in calls and random in-person checks, is essential in containing the transmission of the virus. Our testing requirements for people who return from international travel, for work isolators and rotational workers, allow for early identification of COVID-19. The public health measures and precautions are more important than ever before. These measures are effective in limiting the spread of all strains of COVID-19, including the variants of concern. Since our circuit breaker in December, we have taken a careful and measured approach to ease back to the new normal phase. Today is a reminder of the value and importance of being cautious in our management of COVID-19. There are really those 2 key messages I'd like to stress with Islanders today. The importance of quarantining and isolating travelers is of paramount importance. As well, anyone with even mild symptoms of COVID-19 should be tested and self-isolate until they receive a negative result. The detection of the B.1.1.7 variant is not a cause for alarm in P.E.I. However, it is a warning signal that we should all pause and reflect on our own situation and ask ourselves, are we being responsible for our actions? Are you keeping your circle of contacts small? Are you maintaining a physical distance of 6 feet from people outside your household? Are you washing your hands regularly? Are you wearing a mask properly in public places? Are you staying home if you are feeling unwell? Are you being tested for COVID-19, even if you have even mild symptoms? If you are in self-isolation or a work isolator, rotational worker, or truck driver, Are you following the isolation and testing requirements for your specific situation? P.E.I. could experience the devastating impacts of the COVID-19 variants that we are seeing in other jurisdictions. So we each need to do our part to protect ourselves, our loved ones, and our community. We are not immune from the impacts of COVID-19 or its variants. Working together, we will stay ahead of this virus. Islanders have demonstrated repeatedly they are willing to comply with public health measures and support one another. So as we continue our journey with COVID-19, please be patient and please be kind. Thank you.
Thank you, Dr. Morrison. We will now open the line to some questions from our wonderful friends in the media who have to work on the weekend too. So,
Nicola McLeod, CBC.
Hi, Dr. Morrison. Does the announcement of the B117 presence here on the island change any of your public health recommendations when it comes to mask wearing in terms of doubling up or anything like that? And does it change anything around essential workers traveling to or from the province?
Hi. So at this point in time, we're not changing any of our mask recommendations. Certainly it is mandatory masks in public places. We are in the process of, similar to the rest of the country, and making sure we have really good guidance on the website around mask use and mask wearing, but we will not be changing largely our direction on masks today, and we have been advising really against non-essential travel out of Prince Edward Island, and we will, and that will continue at this point in time, recognizing that people do have to work off island, and there may be medical appointments, custody arrangements, and compassionate reasons that people are traveling.
And you had mentioned that this result came back from the lab in Winnipeg. So going forward, what will be the testing protocol on P.E.I. in terms of looking for variants? Can we do that locally, or will it have to go away nationally?
Well, as I mentioned, all our positive test results are sent off to the National Microbiology Lab, but we have been in discussion with Nova Scotia, who right now has been also sending their results or their positive cases to the NML, but they are hoping that they will be able to do some of the sequencing in Nova Scotia, and we have been in discussion with them that we may be able to use that ability in Nova Scotia, so that would shorten the turnaround time for the sequencing once that starts. So those discussions actually were underway before yesterday.
Thank you.
Travis Kingdon, CBC.
Hi, Dr. Morrison. We learned yesterday that Nova Scotia and New Brunswick have had vaccine doses diverted to the north to aid in their testing campaigns. Has P.E.I. had any doses diverted as well?
Hi, Travis. So we did participate in a national call on Thursday evening, and for logistical reasons, they were looking to reduce some of the Moderna doses. My understanding was right across the country for all provinces for the next shipment of Moderna, and so that will impact us from a Moderna perspective for this month. But we actually also got good confirmation about our Pfizer doses coming in, and may actually see an increased amount of Pfizer in the weeks and months ahead. So that is part of this ongoing vaccine rollout and the challenges that go with it. As well, we do anticipate hearing about the approval of AstraZeneca within the next week, and with that, whether there will be availability of doses of AstraZeneca to this province.
And just to follow up, I'm not sure if you have the number handy, but could you tell me what we were expecting versus what we're now getting in terms of the Moderna vaccine next week?
Travis, I think I was planning to probably give more of an update on Tuesday at the regular briefing about the vaccine and those numbers. So I think I'll probably defer the details of the vaccine numbers to that time.
I think
Thank
it
you.
would just be important to add that as of February 13th, where we're at now and where we thought we would be, we're pretty much in line with where we thought we would be with our vaccination rollout. And I think Dr. Morrison can provide a greater update on Tuesday.
Heidi, CTV.
Hi, Dr. Morrison. I'm wondering how many samples get sent to the national lab. Do you send every sample that's tested, or how do you make that decision when you're looking for variants, especially because there are multiple variants showing up?
So, hi, we have had a total of 114 cases of COVID in this province, and so in our situation, they're all getting sent off to the NML, and all the positive cases are being sent off to the NML. So it's now, I think if we were in the middle of a large outbreak or got into a situation like Newfoundland where there was exponential number of cases and large numbers really quickly, we would signal to the National Microbiology Lab, or maybe in the future to Halifax, urgent request on trying to turn around that genetic sequencing a little bit faster. In this case, we got the results back in about 8 days from when the test was sent off to when we received the results last night.
And do you know if they test, and this may be unfair because it is the national lab, but do they test for every variant, or which variants are we testing for right now at the national lab?
They would be testing for all the variants of concern, and there have been 3 identified in Canada to date. And the B.1.1.7 certainly, I think, the most common one that has been identified in this country.
Mike Robar, The Guardian.
Good afternoon. So I know a few days ago, Dr. Morrison, when you announced that, or not announced, but said that the potential opening of the Atlantic bubble could be as early as April 1st. Do you see, now that we're seeing these variants here and in New Brunswick and Nova Scotia, and most prominently in Newfoundland, do you see a change in your prediction at all?
Well, I think,
Never a prediction.
I think we all had hoped, and I think it's whether it's variant or not, it's really about making sure we have good control of the transmission of COVID-19 in our provinces. There is, I think I also mentioned that there is a concern that if that the variants of concern could take over as predominant strains that are circulating in this country in a number of weeks. And so we are going to have to watch carefully what happens in our own province and our neighboring provinces before we enter into an Atlantic bubble. But certainly that is the hope for everyone. We appreciate the connections and the ties we have with our neighboring provinces. And I know the chief health officers work very closely together, and I know the premiers speak about it often as well, as we take almost day by day, but looking ahead to and still hoping that at some point we can be part of the Atlantic bubble, which really worked very well for for a large number of months in 2020.
And then I wonder, given some reports that have come out about how vaccine effectiveness changes based on these variants, are you anticipating any change to the vaccine plan for the province?
So a good question. It's at this point in time, the mRNA vaccines look like they have good coverage against the B.1.1.7 or UK variant, and I do not anticipate any change. I think it's really important that we get as many people vaccinated as quickly as we can based on our supply, so we can help suppress the illness and COVID infectious pressure in this country and protect our our residents so that as Islanders and as Canadians, so we can get through this COVID-19 and have a really important additional layer of protection.
Thank you.
You're welcome.
Laurent Rigaud, La Voix.
Bonjour, docteur Morrison. J'avais une question sur justement ces variants. Vous avez dit qu'ils étaient qu'ils étaient plus contagieux. Est-ce qu'on sait si le variant brésilien ou le variant sud-africain ou n'importe quel variant, est-ce qu'ils sont aussi plus dangereux, avec plus d'hospitalisation, plus de décès, ou est-ce que c'est juste la contagion?
Bonjour Laurent, alors ils sont en train vraiment de regarder si c'est seulement la transmission, la contagion qui est plus fort avec ces variants, mais ils trouvent de plus en plus vraiment, peut-être plus avec le variant en Amérique du Sud, qui sont devient plus malade et puis ont plus c'est pas seulement la transmission mais qu'ils sont plus malades, mais c'est des fois difficile d'être certain parce qu'on voit plus de personnes qui sont infectées tellement vite. Alors des fois c'est difficile d'être certain si c'est le nombre de personnes et puis si vous avez plus de personnes, vous avez plus la chance des personnes qui sont plus malades. Mais ça nous inquiète à propos des variants. Pas seulement qui sont plus contagieux, mais qu'ils sont aussi plus sévères, vraiment, et les personnes deviennent plus malades.
Merci. Et j'avais une question toujours à propos de ça et de la vaccination. On ne sait pas trop aujourd'hui si les vaccins permettent d'empêcher de transmettre le virus, s'ils ont un effet sur la transmission. Est-ce que si, par exemple, moi, je suis vaccinée et que le virus vient chez moi, est-ce qu'il peut continuer à muter même si je suis vaccinée? Ou est-ce que la vaccination empêche la mutation?
Alors, la recherche vraiment sur les vaccins, les vaccinations à ce moment sont... on sait qu'ils vont réduire la chance d'être malade à cause du COVID-19. Et puis, ils sont en train de vraiment étudier si vous pouvez quand même si vous êtes vacciné, si vous pouvez transmettre le virus, si vous avez vraiment, comme dans le nez, à quelqu'un d'autre qui n'est pas vacciné. Alors... je pense dans les semaines, les mois qui suivent, on va savoir de plus en plus à propos de la transmission, même transmission asymptomatique avec pas de symptômes. Mais on n'est pas certain, mais et c'est pour cette raison qu'on dit que c'est encore important, même si vous êtes vacciné, de continuer de porter les masques, de continuer avec les mesures de santé publique jusqu'à un moment qu'on sait que plus de gens sont vaccinés et on peut savoir les résultats vraiment de protéger la transmission sans symptômes.
Merci.
Okay.
Maria, Radio-Canada.
Oui, bonjour, Dr. Morrison. Donc, ma question est la suivante. C'est pour savoir, en fait, vous avez parlé du port du masque, que le variant ne changeait pas les consignes pour le port du masque, mais en termes d'autres consignes sanitaires, donc la durée de la quarantaine, qui on considère comme des contacts rapprochés, est-ce que pour vous, le variant vient changer quelque chose?
Je m'excuse, j'ai manqué la dernière partie de votre question. Je m'excuse.
Je me demandais si la présence du variant dans la province, pour vous, devrait changer les consignes sanitaires en place, donc notamment la durée de la quarantaine des gens qui seraient affectés par le variant ou les gens qu'on considère comme étant des contacts rapprochés pour ces personnes-là, étant donné que le virus est plus contagieux.
Bonne question. Alors, À ce moment, on est en train de discuter si ça va changer la période d'isolement ou quarantaine pour le cas en particulier. Et on n'a pas beaucoup d'évidence que c'est plus infectif, que ça continue plus de 14 jours. Mais à ce moment, notre cas, on lui parle et dit, c'est possible que vous devrez rester plus longtemps que les 14 jours. Alors, ce n'est pas une décision qui est finale. Mais nous sommes en train de discuter si on a besoin de faire isoler les contacts des contacts dans le futur. Mais à ce moment, c'est vraiment, on change rien, mais de mettre l'importance sur isoler pour les 14 jours. C'est tellement important. Et puis, si vous avez des symptômes, même s'ils ne sont pas sévères, il faut aller faire tester.
Merci. Puis j'aimerais aussi savoir, vous avez mentionné que les passagers d'un vol Montréal-Charlottetown, on leur a demandé en fait de se faire tester. Est-ce que c'est un message qui a été envoyé aux passagers qui étaient aussi d'autres provinces, donc qui n'étaient pas des résidents de l'île du Prince-Édouard?
Alors, tous les passagers qui sont arrivés à l'île du Prince-Édouard, même s'ils ne sont pas encore ici, ils vont être contactés dans la manière qu'on fait toujours, que c'est interjurisdictional notification, on fait ça. Et puis aussi, on fait... pour les vols, on fait la notification au Air Canada comme l'instant, et puis aussi au Santé publique du Canada.
Merci.
Okay, merci.
Well, thank you very much, everyone, and I hope you can continue to go out and enjoy the rest of that beautiful day, and happy Islander Day on Monday to all of you tuned in. So thank you very much, Dr. Morrison.